We do. Our next question is going to come from Christina Peterson at the Wall Street Journal. Christina, you should be live.
Great, thank you. Speaker Pelosi, as we look forward to the next major legislative package, including infrastructure, would you consider including healthcare changes to that package? And if so, what might you be open to?
Well, I think that what is in the public domain as to what is being discussed, and I thank you for your question, is this is an infrastructure bill, and we consider human infrastructure a very important part of how we go forward. We include education and housing in addition to roads and bridges, et cetera. We also have a big broadband provision in there for distance learning and all different other ways that we enhance people's well-being. Okay, so to your exact question, one of the considerations that members are discussing is whether we have aspects of HR 3, as I mentioned, the Elijah Cummings lower drug cost now legislation. If we were able to do that, we could save almost $500 billion, almost like $450 billion that could be used to help improve, as the previous question, improve the affordability and the access, because accessibility and affordability are one and the same in our view. So that is one thing that we would consider. Now, would it also pay for other aspects? Community health centers are very much a priority for us in leadership of Jim Clyburn, our distinguished Democratic, Mr. Pallone, the chair of the committee. They have a plan for broadband expansion, but also community health centers. This is, I would carpet the country with community health centers, and much of that funding can come from the money that we would save by passing HR 3. So those are the considerations that we have to make. Now, we want the bill to be bipartisan, and usually infrastructure has not been partisan, and so to the extent we have to make decisions as we go along, but we would be missing an opportunity if we did not include lowering the cost of prescription drugs. Going back to 2006, when we ran and won the House back, we had 6 for 2006. 6 things we would do in the first 100 hours. 5 of them became law. 1 of them did not. It passed the House, of course. It did not get 60 votes in the Senate, and that was enabling the Secretary of HHS to negotiate for lower prices. We just couldn't get it past 60 votes. Okay, then fast forward to the election of 2016, the presidential candidate on the other side, he said, I'm going to negotiate like crazy to get those prices down. President-to-be Trump, candidate Trump, I'm going to negotiate like crazy. But then he sort of abandoned that when he became president. Well, we're going to negotiate sanely in order to make sure we can reduce the cost of prescription drugs. I have seen grown men cry across the country as we've gone around and traveled when we could about this. When we hear of the story, well, Ms. Patel's story is one that is affected by the cost of prescription drugs as well. So this is really, it's been a priority of ours for a very long time. We couldn't, as I say, get it in 2007 in that January. President Trump spoke about it, but then ignored it, just as he did with the infrastructure, but not to go into that. We want this to be as bipartisan as possible, but we don't want bipartisanship to limit what it does for America's working families, for small businesses, for our children, for our country.
And if I could just ask one follow-up, is expanding Medicare eligibility something that might also be considered in this package?
Excuse me, I'm sorry?
Is expanding Medicare eligibility something that you might also consider including in the package?
Well, there are all kinds of initiatives. In other words, this bill that's coming up, the recovery package, is not the last day that we will be discussing all of this. So our goal is affordable health care for all Americans, affordable quality health care for all Americans. Expanding Medicaid is essential to that. And I understand that even some governors in some red states are thinking more about that, because that's one of their biggest expenses in the state, and we were willing to help with that. But it is yeah, obviously it is something that we want to do. I want a public option. I don't know that we get that in this bill, but this is an ongoing conversation of improvements, of advances that we can make as we celebrate the Affordable Care Act. I wanted public action 11 years, a public option 11 years ago. I didn't succeed then. We had it in the House. We couldn't get it in the Senate. We'll see where we go from here. But everything is on the table. Let me just put it that way. Everything is on the table. We have to be agnostic about the choices we make. What is it that does the most for the American people at the least cost to them, making it accessible and affordable, and to do so in a way that makes it's not about just healthcare in America. It's about the good health of the American people. And that goes beyond, shall we say, the doctor's office. It's about housing, and it's about clean air and clean water and all of the other aspects of the well-being of the American people. So we see the strength of our country, not only in our military might, but in the health and well-being of the American people.